Let's run a peg tube feeding through a Kangaroo pump. So first, we want to check our order. This order says to start Promote at 50 milliliters per hour as a continuous feed with no flushes ordered. Then we'll gather our supplies. You'll need a Kangaroo feeding pump, your prescribed enteral formula. In this case, we're using Promote. You'll need your spike set tubing or feeding bag with tubing, a 60 milliliter syringe, sterile or tap water based on your facility policy, and gloves. Then you'll want to verify tube placement per facility protocol. This may include aspirating gastric contents and checking residual volume. It also may include pH testing or X-ray confirmation for new placements. You'll want to make sure your patient is positioned with the head of bed at least 30 to 45 degrees to prevent aspiration. And you want to remember to keep the head of the bed elevated during each feeding and for at least 30 minutes after if intermittent feeding is ordered. Then you want to prime the feeding pump and tubing. So we'll spike the feeding bottle or pour the formula into the feeding bag. Then you can hang the feed, prime the tubing either manually or prime through the pump. Then you want to flush with 30 milliliters of water to make sure the peg tube is patent. Then you can connect the tubing to the patient's feeding tube. Okay, now you'll program the pump. So we'll program the pump for 50 milliliters per hour continuous feeding like our order said. You can enter in the total volume if needed, but we're going to leave this blank because it's a continuous feeding. Now we can start our feeding. You'll want to monitor for complications like aspiration risk, diarrhea, or clogging or displacement of the tube. That's all for a peg tube feeding with a Kangaroo pump. Happy studying, future nurses.